Hello. Good day to all of our listeners and welcome to a new podcast from Voices of Pasid 2025. I'm Professor غازي, I'm the Pasid President, and today I would like to welcome and explore one of the very interesting podcasts about one of the most cutting-edge frontiers in thyroid treatment with my friend that's joining us from US here in Alexandria, the bride of the Mediterranean Sea in Pasid 2025, Dr. Alireza Falahati from United States, a forward-thinking endocrinologist and researcher in the forefront of novel thyroid therapies. Welcome, my friend.
Thank you so much.
Welcome to Egypt. We have a lot of podcasts here in Voices of Pasid 2025 about the traditional thermal ablative methods like microwave, RFA, laser, and their role in the management of benign and malignant and lymph nodes and parathyroid disorders. Now I would like you to explain to our listeners what is exactly the nanosecond pulse field ablation and how it's different from the ordinary thermal ablative methods.
Absolutely. Well, it's a pleasure to talk about this topic because it's one area that I think has huge potential going forward in the future of ablative therapies. Nanosecond pulse field ablation is the first non-thermal ablation method relevant to thyroid nodules and thyroid tumors. The technology is based on nanosecond pulses of electric power that literally creates micropores in the structure of the nucleus of cells.
Yes.
And therefore kills the cells and causes apoptosis of the cells without destroying the tissue structure because there is no heat, and it selectively kills the cells. Mm-hmm. That makes this procedure very unique, especially in a very sensitive area such as our neck.
Yes. So we can call it that this is one of the game changer, and I would like to little bit go clinically. All of us know that there is a well-established indication for the thermal ablation for thyroid, whatever benign or malignant tissue. Is it the same indication for the nanosecond pulse waves, or have it different indications?
So the indications for nanosecond pulse field ablation, or NSPFA, considering this is a very new procedure, are not as broad as RFA or microwave ablation yet. So there are ongoing studies in the areas of cancerous lesions and also precancerous tumors of the thyroid.
Yes.
So as of now, the indications are for benign tumors.
Yes.
And that is the only indication that this procedure has. But as these studies evolve over time, we will have more and more indications.
Yes.
If you think about the procedure logically, you would think, well, it would be a great procedure for malignant lesions or for pre-malignant lesions. But at this point, if you officially are asking about indications, it is only indicated and approved for benign thyroid nodules.
Yes. So, for example, in the different methods of thermal ablation, HIFO may be differ from the other three parts of the thermal ablation regarding the type and clinical scenario of the nodule. Is it cystic or solid? What about the nanopulse? Is it differ? Does it work in solid, cystic? Is there any maximum size? I knew that you are working and you're having a clinical research about this. Can you tell us something about this?
Absolutely. So I think in terms of completely cystic lesions, we still go with ethanol ablation, as you know very well.
Yes.
And also I'm not familiar with any studies looking at purely cystic lesions, but complex cystic lesions have been looked at, and it's very effective in treating those. Also, the ideal type of nodule is still a solid nodule. There were some questions about hypervascular nodules versus hypovascular nodules.
Yes.
And hypervascular nodules were, for the longest time, questionable, but as we speak, there are more and more data coming in, and different providers who are using this technology are collecting data looking at hypervascular lesions, and so far it has been extremely promising. There is an interesting concept of, as you reduce the target tissue, the blood supply goes down and the hypervascularity goes away. Although this procedure by itself does not cauterize those vessels because it's non-thermal.
Yes.
But as it kills the cells, therefore there is less tissue to supply blood to, the blood supply goes down.
Yes. Can we dive a little bit in the practice itself? We knew that the most popular two methods of thermal ablation, which is the radio frequency and microwave, are utilizing the moving shot techniques with or without the hydrodissection. Is it the same in the NSPA, or there is different methods in working?
Again, keep in mind, because it is not thermal,
yes,
and there is no risk of burning and destroying the nerves or damaging the recurrent laryngeal nerve or the carotid artery or the trachea for that matter. Because of that, hydrodissection is not as important as it is with thermal ablations. So I personally do not do hydrodissection anymore, primarily because of using anesthesia on the side, even if it is conscious sedation or moderate sedation. But by doing that, there is no need for hydrodissection. Now, if your patient is not receiving anesthesia, to just alleviate some of their perception of the electric pulses in their neck, I would still recommend some hydrodissection.
Yes.
But there is no coolant system with the device because there is no cooling needed.
Temperature, yes.
And otherwise, the needle, if you look at it, it's very similar to the RFA or microwave ablation needle. We still use the transismic approach for the most part, and everything else remains the same pretty much.
Yes. And I knew that you are working RFA and microwave and this new method. About the time of the procedure, is it similar or shorter or longer?
It is very, very time efficient, and usually for a lesion that takes about 30 to 40 minutes sometimes, with RFA, for example, as kind of a reference point, with the nanopulse, it is faster. Even though you don't use moving shot technique, you use one area at a time. So these are treatment zones, and you keep the needle in that position for 8 seconds and then move it again back to the next area and next area. But overall, because of the large ablation zones, with this procedure, you can be done within a shorter period of time. So we're talking usually about 20 to 30 minutes max for moderate to large nodules.
Okay, and also I knew that you are a part of some ongoing clinical trials. Can you give us some of the preliminary data about the efficacy and safety in comparison to the RFA and microwave?
Efficacy, it is, in terms of volume reduction, very comparable.
Yes.
In terms of safety, absolutely safe. Because you really cannot cause any damage to the tissue. In terms of timing, we talked about it. And what was the last?
The side effect?
Really none. After the procedure,
for example,
the patients recover very well.
Yes.
Originally, when the probe, the device was approved, we were using a 13-gauge probe. And with that one would experience some bleeding after the procedure for a short period of time, where we would have to apply pressure to stop that bleeding, because it's not cauterizing the treatment area.
Yes.
But now with the 18-gauge probe, it is perfectly fine and it's not an issue anymore.
Yes. And what are the current challenges for this situation? Is it for the approval? Is it for the cost? Is it for the acceptance from the patients?
Absolutely. So one is coverage, and that has been the biggest challenge on my side, because I practice in a private practice settings, not in the hospital, And I'm hearing that if you were to do this procedure in a hospital setting and the hospital would bill for it, the reimbursement would be significant and there would be no question.
Yes.
But in the private practice setting, the biggest challenge is to get paid. So that has been limiting the number of patients I can treat. And most of them are patients who come to me, ask about the procedure because they have heard about it and they know that I am doing it. So they say, I pay for it. I understand my insurance will not cover it. So that's one aspect of it. And really, cost has been the biggest issue. The other part is because the system releases these electric pulses, the patients perceive it in form of muscle cramps and muscle spasms, and that can be very unpleasant in some patients who are widely awake.
Yes.
I have tried muscle relaxants and different ways of trying to relax the neck muscles as much as I can. It has not been very effective. The one and only way to really eliminate any negative symptom or experience on patient side has been the use of sedation.
Yes. Sedation. Okay. And finally, do you think the NSPFA will change the landscape of thyroid management, thyroid nodules management?
I think the way it is going, yes, it might. I still believe that there is a place and there are candidates for RFA and microwave ablation, but I think it will, NSPFA is going to gain a large portion of the market in terms of patients who need to be treated with NSPFA because of its safety profile and efficacy.
Okay.
And we are not talking only about volume reduction, but also the consistency of the nodule. The nodule becomes very soft and less compressive. And that is another advantage that we need to keep in mind. But ultimately, I think all ablative therapies are amazing and they will have their own unique positions.
Yes. And finally, usually I ask the experts like you, what's your advice for the young generations of endocrinologists and surgeons and radiologists if they want to join us in the club of thyroid interventions? Can you give them landscape or advices for them?
I honestly would encourage everyone. If you have the opportunity and you're interested in thyroid management, start with doing more thyroid ultrasound and biopsies. Once you feel really confident and comfortable doing thyroid biopsies and you have no issues with pushing a needle into the neck and doing those biopsies, then definitely consider looking into one of these ablative procedures. At least attend one of the training courses and see it for yourself. And if you really feel like, wow, this is exciting, your heart is into it, go for it. That would be my advice.
My friend Dr. Alireza Falahati, that's come from USA, thank you so much for compelling glimpse about the future of thyroid treatment. I'm Hossam Ghazi, and this is one of the most interesting podcasts of Voices of Pasid 2025. Thank you, and stay tuned for more of the global experts that coming to Egypt, and stay tuned. Thank you.
Thank you very much.